Hello, my name is Naya Haddad, and I'm a member of the American Lung Cancer Screening Initiative, which is ALCSI for short. Today, we'll be giving a little presentation on lung cancer and lung cancer screening. We're very grateful for the opportunity to present to you guys today. All right, before we get started, I'd like to request that everyone is muted during the presentation. However, we would love to take any questions at the end of the presentation, so feel free to put your questions in the chat box for us to address. Before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. We are a team of over 200 passionate students and doctors located across the United States. We've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. We hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. Today, we will discuss both lung cancer and lung cancer screening, addressing questions such as how common is lung cancer, what is lung cancer screening, and how can you get screened? First, we'll talk about some important statistics around lung cancer. Lung cancer is very common. It is the second most common cancer in the United States, excluding skin cancer. This graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. This graph estimates new cancer cases in 2022 for the four most common cancers. As you can see, it is estimated that 236,740 people will be diagnosed with lung cancer in 2022 in the US. To put this number into perspective, it is estimated that about 6% of people will develop lung cancer during their lifetime in the United States. That means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, it is also very fatal. Lung cancer is the leading cause of cancer-related death in the US and the world. In 2022, it is estimated that lung cancer will claim the lives of 130,180 people. This graph shows the American Cancer Society estimates for the number of cancer-related deaths in the United States. As you can see, lung cancer is far more fatal than breast, prostate, and colon cancer, causing more deaths than all of those three combined. Lung cancer makes up almost 25% of all cancer deaths, resulting in about 350 deaths each day. Every year, there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. From this data, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. Stage is a way for doctors to clarify a cancerous tumor based on tumor size, if the cancer has spread to lymph nodes, and if the cancer has spread to other locations in the patient's body. So why is stage important? It's important because the stage that lung cancer is diagnosed at correlates directly with survival. When lung cancer is diagnosed at a late stage, the 5-year survival rate is only 6.7%. We'll discuss this more in the next slide. One way that doctors track the survival of patients is by looking at the 5-year survival. The 5-year survival for patients with localized lung cancer is 57%, but only 25% of lung cancers are diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at a distant stage. And this is why early detection of lung cancer is so important. If we can detect lung cancer at an early stage, then treatment options are better and prognosis is better. With lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. Well, the majority of patients are diagnosed with late-stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer has grown and spread. The most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, when people become symptomatic, the cancer has grown and spread to a point where it is more difficult to treat and the prognosis is poor. If the diagnosis of lung cancer has to wait until the patient has symptoms, it is difficult to catch the lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic? One of the best ways we can do this is through lung cancer screening. Lung cancer screening is done using something called the low-dose computed tomography scan. If you are eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening. In the coming slides, we will discuss what lung cancer screening is, who should get screened, and how to get screened. An important distinction we want to make is that lung cancer screening is done using low-dose computed tomography, also known as a low-dose CT, and not the chest X-ray. We use low-dose CT scan because it provides more detailed pictures than chest X-ray and is better at finding small abnormal areas in the lungs. The picture on the left is a picture of a chest X-ray. The yellow arrow points to an abnormal area in the lungs, but it is unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest. The red arrow points to the abnormal area in the lungs. As you can see, this image is more detailed than the chest X-rays and enables you to see abnormal area in the lungs with greater detail. The question that researchers want to answer is, how effective is the low-dose CT scan at detecting lung cancers at an early stage? An important lung cancer screening trial called the National Lung Cancer Screening Trial, or NLST, tried to answer this question. The NLST was a large national study with over 50,000 patients. The goal of this study was to determine the effectiveness of using a low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. The study included two groups, a group of patients who received annual low-dose CT scans and a group of patients who received an annual chest X-ray. By comparing the stages at which cancers were caught between the two groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an early stage. As you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while the X-ray diagnosed more patients at stage 4. This has important implications for survival. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable, and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to an X-ray. A concern with any screening test is accuracy. Essentially, how good is the low-dose CT scan at catching lung cancer? For every 100 individuals undergoing CT lung screening, 25 will be positive and 75 will be negative. Of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at identifying people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive and the test will not miss your cancer. Out of the 25 individuals who are positive for lung cancer, 23 turn out to be negative for cancer, primarily with follow-up imaging alone.
What do you think happened?
Oh, Naya, looks like you're muted.
Sorry, was that just now that it got muted? Or has
It,
it
it
been
just
the
it just
whole
happened.
time?
No worries. No worries.
Okay, I'll repeat the last sentence. This means that even if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. The two individuals that have a positive test result and truly do have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. This means that their treatment options and prognosis are much better. The results of the NLST were published in 2011, 11 years ago. Several studies have been published since then, further confirming the life-saving benefit of lung cancer screening in high-risk populations. One of the most important is the Nelson trial. In February of 2020, the results of the Nelson trial were published. Like the NLST, the Nelson trial had two groups. However, unlike the NLST, the Nelson had a group that received low-dose CT scans and a group that received no screening of any kind. A total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0 baseline, year 1, year 3, and year 5.5, or no screening. The results confirmed the life-saving benefit of lung cancer screening by low-dose CT. In the screening group, 58.6% of lung cancers were diagnosed at stage 1. In the non-screening group, 13.5% of lung cancers were diagnosed at stage 1. Early detection translates to a reduction in mortality. In the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. The Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate was reduced significantly. Lung cancer screening significantly reduces lung cancer mortality, but who should get screened for lung cancer? The United States Preventative Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 to 80 who have a 20-pack year smoking history or greater, and who are current or former smokers who quit within the past 15 years get annual low-dose CT scans. The current screening guidelines require you to have a 20-pack year smoking history. Now, pack year is probably a term that most of you have not heard before, but it is just a way for doctors to track your smoking history over a period of time. A pack year is defined as smoking a pack of cigarettes per day for a year. So, for example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20-pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20-pack year smoking history. The important takeaway is that there are many different ways to reach 20-pack years, and the pack year is a way to help doctors track your smoking history. Here is another way to track smoking history by counting the number of cigarettes smoked per day rather than packs of cigarettes. On average, each pack of cigarettes has about 20 cigarettes. So we can take the number of cigarettes smoked per day, divide by 20, and multiply by the years smoked to calculate the pack year smoking history. These new guidelines will nearly double the number of eligible individuals for lung cancer screening in the United States. Notably, the most apparent increases in eligibility will occur among women and minorities. However, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines. After smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and can build up indoors. Moreover, secondhand smoke causes almost 3% of new diagnosis of lung cancer and is expected to cause about 3% of deaths from it in 2022. Additional risk factors include exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. It is important that we recognize these additional risk factors because although lung cancer has a strong association with smoking, there are a large number of people in the United States who have never smoked and still get lung cancer. Lung cancers can also occur in never smokers, who are individuals who have smoked less than 100 cigarettes in their lifetime. Because lung cancer has a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the 8th leading cause of cancer-related death in the United States and world. More never smokers die from lung cancer each year than people die from ovarian cancer. This graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. It is then further broken down by whether they are a current, former, or never smoker. As you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. Right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the United States, 60 to 70% of never smokers diagnosed with lung cancer are women.
So, hi everyone, my name is Medha, and I'll be summarizing some of the information that Naya has talked about so far. So, just to summarize everything, lung cancer is the leading cause of cancer-related death in the United States. And the reason it's so deadly is because most lung cancers are diagnosed at a late stage when they've spread to other locations in the body. Importantly, early detection through lung cancer screening by the use of the low-dose CT scan can reduce lung cancer mortality by up to 33%. So this graph shows that the national screening rates for some of the most common cancers, including breast, cervical, and colon cancers. The screening rates for these cancers average around 73%. And now I'd like to ask all of you to guess what the average screening rate is for lung cancer, and keep your guess in your mind. So now that everyone has a prediction, let's see how your answer compares to the actual screening rate for lung cancer. So the screening rate for lung cancer is only 5.7%. All 4 of these cancers have screening tests that are recommended by the USPSTF, but the uptake of lung cancer screening is much lower than the uptake of screening for other cancers. The American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the United States, we would save 48,000 lives. However, we're only screening 5.7%, which means that a lot of lives that could be saved are not being saved. So why is that? Well, the lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. In the next slides, we will discuss each of these topics. The important takeaway, though, is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. The first potential concern we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. Medicare will only cover lung cancer screening until the age of 77, and not all state Medicaid plans cover lung cancer screening. Additionally, patients do have to pay the usual fees for provider appointments before or after the scan. However, it's important to note that New York state Medicaid plans typically do cover lung cancer screening, so that shouldn't be an obstacle here. So as I just mentioned, not all state Medicaid plans cover lung cancer screening, and this is a map last updated in July 2022, showing which state Medicaid plans do and do not cover lung cancer screening. So the dark purple states have state Medicaid plans that do cover lung cancer screening and use the updated USPSTF guidelines. The purple states also have state Medicaid plans that cover lung cancer screening, but they may be using more outdated guidelines. And in the blue states, it's not covered at all. And in the gray states like Hawaii, this information wasn't available. But as you can see, New York is a dark purple state. So it does have state Medicaid plans that cover lung cancer screening, and they also use the updated USPSTF guidelines. So the first step to getting a patient screened for lung cancer is having them talk to their primary care provider. So this is just the doctor that you usually go and see. There are certain questions a primary care provider has to ask and topics that have to be discussed, one of which is the patient's pack-year smoking history, which we saw how to calculate in earlier slides. To find accredited lung cancer screening centers, patients can go to the American College of Radiology website. They can type in the state or city they live in to see where accredited lung cancer screening facilities are located near them. And the website's URL is listed on the middle left-hand side of the screen. And the screenshot shows a map of the accredited lung cancer screening facilities in New York. Each red pin is an accredited screening center. And although I wasn't able to get a screenshot of solely New York City, there are a lot of accredited screening centers in the area. So it shouldn't be too hard to find one near you. As far as the experience of getting a low-dose CT scan, it will require you to lay on your back for about 5 minutes. And one thing to note about this process is that it doesn't hurt at all because it's a low-dose CT scan. You don't need to use contrast, which means that there are no needles or injections involved. The low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is very low. So a way that doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. And this is just a way to measure radiation and compare the levels of radiation received during different activities and over time. So for a low-dose CT scan, you'll be exposed to 1.5 to 2 millisieverts of radiation, which is a lot lower than a full chest CT scan, which requires a radiation dose of 8 millisieverts. And just to put that in perspective, every year you're exposed to 3.11 millisieverts of radiation just from breathing, cosmic radiation, eating, and radiation from the earth. So a low-dose CT scan exposes you to less radiation than you are exposed to from just existing on Earth, which means that the level of radiation you receive from annual lung cancer screening is very minimal. That being said, if you're concerned about this, this is always something you can discuss further with your primary care provider. So now to discuss steps after screening. Your primary care provider has referred you to a screening center and you received a low-dose CT scan. So what's next? Well, the doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. As far as results go, there are 3 most likely outcomes. The first outcome is that the scans are normal. And if that's the case, then you should just look to get repeat scans in a year. Next, if the scans are abnormal but probably benign, then you should talk to your doctor about next steps, which might involve more scans, tests, or biopsies. If the scans are abnormal and suspicious, then the patient will likely have to undergo additional testing, such as a biopsy. So lung cancer screening saves lives, but a question you may be wondering is, can individuals still get screened for lung cancer during the COVID-19 pandemic? And is it safe to do so? And I know that a lot of restrictions surrounding COVID have decreased as of the recent months, but it is still a concern, particularly for older populations. So we thought it would be important to discuss that. So during the pandemic, the number of cancer screenings did decrease significantly, but lung cancer isn't going to stop because there's a pandemic. And if a patient is at high risk for developing lung cancer, it's really important that they get their annual lung cancer screening test. So right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the screening process if you'd like. And if you follow any necessary precautions, getting screened is perfectly safe, and the pandemic shouldn't deter you from getting screened. So additionally, as we mentioned earlier, while smoking is a risk factor for lung cancer, there are numerous other risk factors as well. So one of the biggest causes of this is radon. Radon is the second leading cause of lung cancer in the general population and the leading cause of lung cancer in individuals who don't smoke. Radon is responsible for about 21,000 lung cancer deaths every year. And what it is it's a radioactive gas released from the normal decay of elements like uranium, thorium, and radium in rocks and soil. And without special equipment, it's difficult to detect because it's invisible, odorless, and tasteless, and it seeps through the ground and diffuses into the air. Radon is present in nearly all air, but at low levels. Only about 0.4 picocuries per liter of radon is normally found in the outside air. It's when radon levels are high that individuals are at risk of developing lung cancer. So how does this happen? Well, radon can enter homes and collect indoors. It can also be released from building materials or from water obtained from wells that contain radon. Radon levels can be higher in homes that are well insulated, tightly sealed, or built on soil rich in the elements uranium, thorium, and radium. Radon decays really quickly, giving off tiny radioactive particles, and when inhaled, these radioactive particles can damage the cells that line the lung. Long-term exposure to radon can lead to lung cancer, the only cancer proven to be associated with inhaling radon. And radon can also impact your pets. So high levels of radon can damage their respiratory systems and put them at risk for cancer. Some areas of the United States have higher radon levels, with the top states being Alaska and South Dakota, but it's crucial to remember that radon can be an issue in any home. So this is a map of radon zones from the United States Environmental Protection Agency, or the EPA. Zone 1 indicates regions with radon levels higher than 4 picocuries per liter, and that's what's shown in the red. Zone 2 indicates radon levels from 2 to 4 picocuries per liter, which is shown in the orangey color. And the yellow zones are those less than 2 picocuries per liter. However, the EPA does recommend that all homes get tested for radon regardless of location. The only way to truly know the radon levels of your individual home is by testing, and testing is easy and low cost. To test your home, you can pick up an at-home testing kit from a home improvement store like Home Depot or anything, or hire a radon measurement specialist. You can also call 1-800-SOS-RADON or go to the National Radon Program Services website. The average cost for a test kit is between $10 to $30, and the EPA has set the action level for radon at 4 picocuries per liter. If the results from the test are 4 picocuries per liter or higher, you should probably take action. And to do this, you can contact your state radon office to get the name of some local representative who can give you further advice. And sometimes these can just be quick DIY fixes, but if you have a really significant radon problem, you might need to call a specialist. So another question that we often get is how vaping and e-cigarette use affects lung cancer risk. So vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigarettes are still being studied, it is clear that for individuals who have never smoked before, they can increase the risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. These arise both as elements of the e-liquid and as a result of organic reactions within the device. So various studies have demonstrated in vitro transforming and cytotoxic activity of these derivatives. Vaping does cause fewer health risks than smoking, but it's not a risk-free activity. Vaping can increase heart rate, decrease air volume in the lungs, and increase airway resistance. Furthermore, e-cigarette device use has been significantly increasing, particularly among young adults and non-smokers, making it an area of significant concern for the future and a topic of ongoing research. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation, and likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early, but you have to do both to fight the disease. For every year after an individual quits smoking, the risk for lung cancer is reduced by 8 to 17%, depending on the type. Another reason that smoking cessation is important is because it's required by Medicare and Medicaid services to qualify for lung cancer screening programs. However, we do understand that smoking cessation can be difficult. There are a lot of resources out there for people trying to quit smoking, and some great programs are the Renown Health and Wellness Quit Smoking Program and the Nevada Cancer Coalition's Quit Smoking Program. As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer is the deadliest cancer in the world, and while lung cancer screening can save many lives, very few high-risk individuals are currently getting screened. With ALCSI, we are working to address all aspects of this issue. Last fall, ALCSI worked with US Congress members and senators to draft and advocate for the first ever House and Senate resolutions recognizing the importance of the early detection of lung cancer through screening. In December 2020, the Senate resolution was passed with unanimous consent, making it the first time the United States Senate has ever recognized the importance of lung cancer screening. ALCSI has also been actively working with Representative Brendan Boyle and Senator Tina Smith to draft and advocate for Catherine's Law for Lung Cancer Early Detection and Survival Act of 2021. Additionally, we've been giving webinars such as this one to educate a variety of audiences about lung cancer screening, including students, community members, healthcare providers, community leaders, and policymakers. We believe that educating communities, especially students, about lung cancer and lung cancer screening is crucial to lowering the number of deaths associated with the disease. We also focus a lot of efforts on students because students greatly impact and influence the healthcare of their parents. And we hope by educating students about important measures that can be taken, we will be able to help the students and their families at large as well. So if you know anyone who might be eligible for lung cancer screening, or you think you might be eligible yourself, please share the link given by the QR code so that you can contact one of our doctors about lung cancer screening. And if you'd like to learn more about upcoming events that we have, you can find these events on our website at www.alcsi.org. And you can also email info@alcsi.org. So I'm going to stop screen sharing now, and I'll take a look at the chat to answer any questions.
Yeah. Well, firstly, Medha, that was a wonderful presentation. Thank you to the both of you. I know Naya's not here. She had to leave mid-presentation, but it was very informative. Thank you so much for all that info. So before we continue on, I see here we have from Sandy to see, Medha, if you could possibly discuss COPD and if that affects any risk factors along lung cancer or getting lung cancer.
Yeah, so COPD, or chronic obstructive pulmonary disease, is a complication that generally occurs during smoking. And it's actually not one single condition. It's a class of conditions, including emphysema. And these typically occur when, due to smoking, the alveoli in your lungs are damaged. So they can't expand as well, and essentially they don't function as well. And while having COPD is not going to directly cause lung cancer, it's the fact that it's generally smoking that causes COPD, which can also cause lung cancer. So I hope that answers your question.
Can you hear me?
I can. Oh, yes, we can, Sandy. Yep, loud and clear.
Good. Okay, I have COPD. I was a smoker for about 20 years, about a pack a day, and I did smoke a lot of pot. This was way back. I'm 80 now. I stopped smoking in March of 1986. So what's that? 37 years. I have a cough that it's a dry cough. It's not, it's not a mucousy cough. No blood, anything like that. Never. It's more an irritation. But what my problem is I can't get the air out. So sometimes, what happens is I sneeze 5 to 8 times to get the air out. I did have one of these scans. They said they saw nodes. Am I in trouble? Talk to me.
Okay. So first of all, I do want to say that I am not a healthcare provider. I'm not an expert on lung cancer. I have talked to a lot of patients,
Right.
but what it sounds like is maybe you should talk to your doctor further about whether those nodes would require any further testing.
Yeah.
Normally, if they look abnormal or malignant and they look suspicious for lung cancer, your doctor will advise you to get further scans. However, there's also a good chance that those nodes are just benign.
That's what I think.
Yeah. So again, I'm not an expert on this. I would talk to your doctor more, but if they haven't advised any further screening, I wouldn't be too worried.
Okay, thank you. I appreciate it. Thank you very
Of
much.
course.
If you could send us something at the end, a way to use your facilities.
For sure. If anything, for all the folks that are joining today, I'm going to follow up with Medha and Naya just to see if they have any additional materials. So I will send everyone an email with everything that they'll provide to us for sure.
Great. Thank you.
No problem.
Thanks.
Yeah.
Thanks.
And Medha, I have a question from on my end here. I know I saw, with more modern happenings now with how people smoke, vape, things like that.
Right.
And I know I'm just curious now. So I'm assuming that there's no current guidelines when it comes to vaping or e-cigarettes, right? In terms of like eligibility for screenings.
Right. So actually, even though the USPSTF guidelines expanded in the early 2010s to include more people, they're still very limited because they only include people who have smoked, whereas there's a lot of other risk factors, like as you mentioned, vaping and e-cigarettes, as well as radon exposure and asbestos exposure. So there are a lot of really great organizations out there working to expand the eligibility guidelines. And one of the things that they're working to include are vaping history and e-cigarette history. So that is like a work in progress.
Okay. And I'm also curious too, because I know, Sandy, you mentioned this as well, but you mentioned previously that you smoked marijuana. And I was just curious, has there been any talks about guidelines regarding marijuana usage, or if that's, just due to the fact that people are smoking it, that it could, obviously damage the lungs. So I was just wondering, were folks mentioning anything regarding possible lung cancer because of that?
There haven't.
I don't think people are. I don't think people are, but they should be, because there is still a lot of tar in there, and they should be. And I know a lot of people that were my age that died 20 years ago and never smoked a cigarette in their life, but they were really heavy pot smokers, so they should be.
Yeah, I completely agree. Like, it's not, lung cancer screening has become more of a focus of research in recent years, but it's still not as expansive as we would like it to be, which is why we're doing this work. So there are some newer studies coming about vaping and e-cigarettes, but I honestly haven't heard very much about smoking marijuana.
Okay. Oh,
yeah.
And I just want to, so, excuse me. I was just wondering if there's anyone else that have any questions for Medha about what we discussed today or anything along those lines. And I just want to say that once again, thank you for this presentation, because I lost my grandfather back in February due to lung cancer. So I think that this is a very, very, very important presentation and very providing to everyone. So thank you so much. But folks, are there any other questions for Medha regarding lung cancer screenings, things of that nature? Please feel free to unmute yourself if you would like to ask, or type it in the chat. Oh, okay. No problem. So, I mean, if anything, Medha, I don't know if you have any final words before we head out.
Yeah, I think I'll just send you maybe some further links as to information, and you can get that out to everybody here. And I just want to thank everybody so much for coming today. It was really great speaking with you all. And if you have any further questions, please don't hesitate to visit our ALCSI website, and we have other contact information there. So,
Medha, I think we actually have a question from Sheldon.
Okay. Oh, great. Yes.
Yeah. I think this would be a useful presentation on a larger scale. I'm the co-chair of the Health and Human Services Committee for the Community Board.
Okay.
Would it be possible at some point to do this we can get a very large group of people by advertising in advance? Okay.
Yeah, we'd love to.
Okay. So how should I contact?
If anything, Sheldon, I'm going to be emailing you registered for the event, correct?
Sure.
Yeah. So if anything, I'm going to be sending emails out to everyone that participated today with all the resources and things like that. When you see that email, just send me a message and then we can figure things out from there. Okay.
Super. Thank you.
Awesome. Appreciate it. Great. Okay. Well, folks, I think unless anyone else has any other questions. Good. Okay. So like Medha said, she's going to pass me all the necessary information. I'm going to email it to everyone. Yeah. So thank you everyone for joining once again. We really appreciate it. Yeah. And we're looking forward to more similar events like this, more educational events like this, because we know we just want to share all this information for you folks because it's so important. So thank you once again for joining and have a great rest of the day, everyone. Okay. Bye.